Welcome to my channel Medicine Guide. As we have discussed in the last video the uses and side effects of azithromycin. In this video we will discuss what to avoid when taking azithromycin, its drug interactions, and disease interactions. So let's start, but before that please subscribe to my channel Medicine Guide. What to avoid when taking azithromycin. Do not take antacids that contain aluminum or magnesium within 2 hours before or after you take azithromycin. These antacids can make azithromycin less effective when taken at the same time. Antibiotic medicines can cause diarrhea, which may be a sign of a new infection. If you have diarrhea that is watery or bloody, contact your doctor. Do not use anti-diarrhea medicine unless your doctor tells you to. Avoid exposure to sunlight or tanning beds. Azithromycin can make you sunburn more easily. Wear protective clothing and use sunscreen, SPF 30 or higher, when you are outdoors. Avoid other drugs that can cause QT prolongation or irregular heart rhythm. Major drug interaction, azithromycin with hydroxychloroquine. Using azithromycin together with hydroxychloroquine may increase the risk of heart-related side effects including an irregular heart rhythm that, while rare, may be serious and potentially life-threatening. You may be more susceptible if you have a heart condition called congenital long QT syndrome. Other cardiac diseases, conduction abnormalities, or electrolyte disturbances, for example, magnesium or potassium loss due to severe or prolonged diarrhea or vomiting, or are being treated for COVID-19. Talk to your doctor if you have any questions or concerns. Major drug interaction, azithromycin with citalopram. Using citalopram together with azithromycin can increase the risk of an irregular heart rhythm that may be serious and potentially life-threatening, although it is a relatively rare side effect. You may be more susceptible if you have a heart condition called congenital long QT syndrome. Other cardiac diseases, conduction abnormalities, or electrolyte disturbances, for example, magnesium or potassium loss due to severe or prolonged diarrhea or vomiting. Talk to your doctor if you have any questions or concerns. Your doctor may already be aware of the risks, but has determined that this is the best course of treatment for you and has taken appropriate precautions and is monitoring you closely for any potential complications. You should seek immediate medical attention. If you develop sudden dizziness, lightheadedness, fainting, shortness of breath, or heart palpitations during treatment with these medications, whether together or alone, major drug interactions, azithromycin with cholera vaccine, live. If you are currently being treated with azithromycin or have been treated within the last 14 days, you should talk to your doctor before receiving cholera vaccine, live. Antibiotics like azithromycin may reduce the activity of the vaccine. To ensure adequate vaccine response, vaccination with cholera vaccine, live should be given either at least 14 days after you complete your treatment with azithromycin or 10 days prior to starting treatment with azithromycin. Talk to your doctor if you have any questions or concerns. Moderate drug interaction, azithromycin with clarithromycin. Using azithromycin together with clarithromycin can increase the risk of an irregular heart rhythm that may be serious and potentially life-threatening, although it is a relatively rare side effect. You may be more susceptible if you have a heart condition called congenital long QT syndrome, other cardiac diseases, conduction abnormalities, or electrolyte disturbances, for example, magnesium or potassium loss due to severe or prolonged diarrhea or vomiting. Talk to your doctor if you have any questions or concerns. You should seek immediate medical attention if you develop sudden dizziness, lightheadedness, fainting, shortness of breath, or heart palpitations. During treatment with these medications, whether together or alone, moderate azithromycin with digoxin. Talk to your doctor before using digoxin together with azithromycin. Combining these medications may increase the blood levels and effects of digoxin. Your doctor may be able to prescribe alternatives that do not interact, or you may need a dose adjustment or more frequent monitoring by your doctor to safely use both medications. Contact your doctor if you experience nausea, vomiting, diarrhea, loss of appetite, visual disturbances, blurred vision, light halos around objects, green or yellow vision, or an abnormally fast or slow or uneven heartbeat, as these may be signs and symptoms of excessive digoxin levels. Moderate warfarin with azithromycin. Using azithromycin together with warfarin may cause you to bleed more easily. You may need a dose adjustment based on your prothrombin time or international normalized ratio, INR. Call your doctor promptly if you have any unusual bleeding or bruising, vomiting, blood in your urine or stools, headache, dizziness, or weakness. It is important to tell your doctor about all other medications you use, including vitamins and herbs. Do not stop using any medications without first talking to your doctor. Now have a look on azithromycin disease interactions. Major disease interaction, liver disease, applicable conditions, biliary obstruction. Azithromycin is contraindicated in patients with a history of cholestatic jaundice/hepatic dysfunction associated with prior use of azithromycin. Azithromycin is primarily eliminated by biliary excretion. However, the pharmacokinetics of azithromycin have not been established in patients with liver dysfunction. Therapy with azithromycin should be administered cautiously in patients with liver and/or biliary disease, abnormal liver function, hepatitis, cholestatic jaundice, hepatic necrosis, and hepatic failure have been reported, with some fatal cases. Treatment should be discontinued immediately if signs/symptoms of hepatitis occur, moderate disease interaction, QT prolongation, applicable conditions, magnesium imbalance, arrhythmias, congestive heart failure, hypokalemia, prolonged cardiac repolarization and QT interval have been reported in patients receiving treatment with azithromycin. Providers should consider the risk of QT prolongation, which can be fatal, when weighing the risks and benefits of azithromycin for at-risk patients, including patients with known prolongation, which can be fatal, when weighing the risks and benefits of azithromycin for at-risk patients, including patients with known prolongation of the QT interval, history of torsades de pointes, congenital long QT syndrome, bradyarrhythmias, or uncompensated heart failure, patients with ongoing proarrhythmic conditions such as uncorrected hypokalemia or hypomagnesemia, clinically significant bradycardia, or receiving other drugs that prolong the QT interval, myasthenia gravis. The use of macrolide antibiotics has been reported to exacerbate symptoms of myasthenia gravis and trigger new onset of symptoms of myasthenic syndrome. Therapy with these agents should be administered cautiously in patients with a history of myasthenia gravis. That's enough for this video. If you want to watch more videos like this, please keep watching my channel. Disclaimer: Channel's intention to make this video is for informational purposes only. Consult your doctor or healthcare provider for use of any medicine or for query of any disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine Guide.